Hi there, I'm Katie Clark, your favorite YouTube IBCLC, and I'm here to help you feel more confident and comfortable in your breastfeeding journey. Today, we're tackling a question I get all the time: how to fix uneven sides while breastfeeding. So that's with like milk supply or just the size in general. Before we dive in though, I want to make sure you know about my free breastfeeding troubleshooting guide that's perfect for moms just like you. It's packed with tips on how to handle common breastfeeding challenges, and you can download it for free using the link in the description below. So make sure you grab that. Okay, let's dive in and even things out. First, let's talk about why this happens. It's super common for breastfeeding moms to notice one breast producing more milk or being fuller than the other. Here's some of the reasons why it might happen. Your baby's preference. Some babies favor one side because it's more comfortable or easier to latch onto. This can lead to the breast being stimulated unequally, leading to more milk being produced on one side. Then just milk supply differences in general. Your milk production might naturally vary between breasts. This is totally normal. Breasts are cousins, not twins. They are not identical and may have a completely different makeup of glandular tissue. Then there's feeding patterns where if one side is being used more frequently or drained more effectively, it can lead to lopsidedness. I've already touched on this, but anatomical differences. If you've had breast surgery of any kind or had some issues with development for any number of reasons, one side may make more or less. Here's a few steps for getting through this. First, we want to encourage the baby to feed on the less preferred side. To even things out, start by encouraging your baby to nurse from the smaller side or less preferred breast. Begin with the smaller breast to ensure it gets emptied. Switch feeding is another technique, which is where you alternate breasts during a single session to stimulate milk production on both sides until you just go back and forth more frequently. Also remember that positioning matters. You want to try different breastfeeding positions, such as the koala position or side lying, to make that smaller breast more comfortable for your baby to feed on. Next, you might want to consider pumping to boost supply. If your baby strongly prefers one side, pumping can help to balance things out. You want to try and pump that side after nursing for about 5 to 10 minutes to stimulate milk production. You don't have to do this for every feed. You can also try to parallel pump, which is pumping while you nurse. Next, you want to consider adding in an extra pumping session for the smaller breast to increase supply and fullness. Some moms find success with adding in a power pumping session a day just for that side. If you're short on time, wearable pumps can make it easier to fit this into your routine. You can also try using something like the Haka or the Boone Trove to get a little bit more milk. Another option is to use hand massage and compression. During nursing or pumping, using gentle massage or compressions on the smaller breast to help it empty more effectively can help to even things out. You can also just try to randomly hand express throughout the day and see if that helps. Any extra stimulation is going to be beneficial. When you are nursing or pumping, make sure you're massaging and using hands-on pumping. The more consistently the small breast is empty, the more likely it is to catch up. Next, we want to address discomfort. If you or your baby are uncomfortable, that may lead to less effective nursing sessions or side preferences. Here are some ways that we can address that. Going back to what I said earlier, try new positions. You might find something that you both respond to better that keeps your baby feeding longer on the preferred side. You can see a chiropractor or another body worker, especially if there's tension or if your baby has torticollis. This can come from birth, from being swaddled a lot, using a lot of swings, or even oral restrictions. If your baby's uncomfortable, that can make it more difficult to feed. I've seen chiropractic work wonders on babies that have side preferences. If you don't want to use a chiropractor, gentle movements like the guppy position or happy baby, where they go back and forth like this with their arms touching, can be really beneficial to help your baby move their head. I'll show you a little demo of those both here. Let's talk about adjusting your routine. Here are a few lifestyle adjustments to help balance things out. You want to even out the time spent with extra nursing or pumping on the smaller side until the size difference evens out. Be patient. It can take days or even weeks for milk supply to adjust. Consistency is key. This is the biggest one, is to have realistic expectations. At the end of the day, having one side produce more than the other can be very normal. Sometimes you can't really do anything about it, and so just be patient. A well-fitted bra can help you feel more balanced while you're waiting for things to even out. So when to seek help? If the size difference is extreme, or you notice persistent pain, lumps, or redness, or your baby just refuses one side altogether, definitely reach out to a lactation consultant or other healthcare provider. These can be signs of other underlying conditions. But honestly, at any point, if you're feeling like you can't manage this on your own, reach out. It never hurts to get help from a professional. And my team of IBCLCs would love to help you, and we are available virtually worldwide. You can learn more at the link in the description below. Lopsided breasts are super common. Remember, breastfeeding doesn't have to be perfect to be successful. You're doing an amazing job, and before you go, I'd love for you to grab my free troubleshooting guide below. It has so many great tips for other common breastfeeding issues, and I know you're gonna find it beneficial. You can find it in the description below. If you enjoyed this video, don't forget to like, subscribe, and share it with a friend. In the meantime, leave any questions or requests for other videos below, and I will see you next time.